My work is about the use of epitope editing to enable immune therapies for acute myeloid leukemia. And acute myeloid leukemia is a cancer that arises from immunotherapeutic stem and progenitor cells, and it is still associated with a very poor prognosis, and less than half of the patients can achieve long-term remission. And this is despite all the new agents that have been introduced into the clinic in recent years, which is also a significant novelty, but pretty much none of these new agents are immune therapies. And this is due to some limitations associated specifically for AML. Obviously, we know that immunotherapies have an extraordinary potential, and we've seen this since the introduction of CD19 targeted CAR T cells, for example, for B lymphoblastic leukemia or lymphomas. But again, for AML, it's really difficult to design such an approach, because there are the surface targets that AML presents are typically also shared with normal hematopoietic stem and progenitor cells or differentiated myeloid cells. So when using an immune therapy to eliminate this target or the cells that bear these antigens, you will end up having also on-target off-tumor toxicity. And in case of myeloid cells or stem cells, this is really limiting and cannot really be brought to the clinic. So the idea here is that we developed an approach to eliminate this toxicity by modifying the healthy stem cells that are used in bone marrow transplantation, making them pretty much invisible to the immunotherapy and therefore eliminating off-tumor toxicity. This works by modifying very precisely the epitope in the target gene in stem cells, and it's really limited to the bare minimum, so we just change one amino acid at a time, which is sufficient to abrogate the binding of therapeutic antibodies or CAR T cells, and this results in still preservation of surface expression and also target gene functionality. And this is different from other approaches that we've seen in recent years being published, such as the knockout of the target gene on hematopoietic stem cells, because again, if you have to use gene knockout, you can only apply this strategy to dispensable genes that are irrelevant for hematopoietic development. Instead, by just doing a very precise modification, just one residue, you can choose a mutation that preserves expression and function. And in theory, then you can target nearly any antigen on leukemia cells, regardless if they're expressed also on normal HSPCs or myeloid cells.